Hello, we are now live. Good morning po to our media partners and viewers. Welcome to our Kapihan session this Wednesday, February 16, 2022. Now, despite their busy schedules, here to grace us with their expertise and presence today are members of the Vaccine Expert Panel. We have Dr. Nina Gloriani, who is the chair of the Vaccine Expert Panel, and of course, Dr. Wilda Silva. Today, they will be presenting updates on vaccine data for Pfizer for the pediatric population of 5 to 11 years old. So to formally begin our forum, may we recognize Doc Wilda and Doc Nina to please present their slides.
Morning!
Good morning!
Yan.
Good morning po.
So, maybe just to say, it will be Dr. Wilda who will be presenting the first few slides. Tapos po magpapalitan kami. So, you're on, Dr. Wilda.
Thank you, Dr. Nina. Magandang umaga po sa inyong lahat. I am Dr. Wilda Silva, and today we will provide you updates on the Pfizer pediatric vaccines for the 5 to 11 years old. Next slide. So we will be talking about all of this. The Pfizer COVID-19 vaccines for children, the NVOC vaccination report as of February 14. I know that is not the latest because you are given a report daily by the National Vaccination Operations Center. We will talk about the safety of Pfizer vaccines for the 5 to 11 years old. We will show you the phase 1 and the phase 2 study results. We will also talk about immunogenicity, efficacy of the Pfizer vaccine, and the multi-system inflammatory syndrome for children, seen in children, the general and other adverse reactions like myocarditis, countries administering vaccines for the 5 to 11 years old, and below, and the updates on the WHO SAGE recommendation, the CDC data on waning immunity after the mRNA booster doses, and Ma'am Nina will provide you the summary of data in the end. Next. All right. So flashed on the screen is the Pfizer-BioNTech COVID-19 vaccine dosage chart. So I would like to say that Pfizer vaccine is the only vaccine that has an EUA for the 5 years and older here in the Philippines. And it comes in two preparations. One is a preparation for the 12 years and older, which comes with a purple cap, and the one for the 5 to 11 years old is another preparation which comes with an orange cap. So the Pfizer vaccine, as I have mentioned, is the only COVID-19 vaccine that has an EUA for the younger pediatric population. Now, in the graph, you can see here the primary series for the Pfizer-BioNTech vaccine. And the eligible population are the 5 to 11 years and another subset of the population, the 12 years and older. We all know this, that the primary series is given for 2 doses separated by at least 21 days apart. For additional or third dose, this is indicated or given for the moderately and severely immunocompromised person. Again, we can give this to the 5 to 11 using the preparation that is for the 5 to 11 years old, and 12 years and older using the preparation for this particular age group. I would like to also mention the booster doses. If you will take a look at what is written in the lower most left-hand corner, booster dose, it says here, is given at least 5 calendar months after completing the primary dose. But here in our country, our guideline says we give the booster after 3 months, at least 3 months. And again, I would like to reiterate that we have 2 preparations for the Pfizer vaccine. One is for the 5 to 11, the other one is for 11 and older. It comes in a different color. The cap comes in a different color. So for our vaccinators, please look at the color of the cap if you will inoculate this to the client in front of you. Next slide. Okay, so this is the data we got from the National Vaccine Operations Center, and this is as of February 14, 2022. And the one in the red box says that as of Feb 14, we have inoculated a total of 148,615 5 to 11-year-old target. So congratulations, everyone. I know the numbers are increasing. Right now, here in Region 1 Medical Center in Dagupan, we have a lot of 5 to 11 in our vaccination site. And I'm very happy that the response of our parents and guardians have been all positive when we started inoculating this age group as of yesterday. Next. Okay, so safety data of the COVID-19 vaccine. So what to expect after getting inoculated with this Pfizer-BioNTech vaccine? So in the left-hand corner of the slide, written here are the most common local reactions: pain, swelling, but mostly mild to moderate in severity. And for the systemic reactions, we have fatigue, muscle pain, headache, chills, fever. Again, mostly mild to moderate in severity. So now let us take a look of the graph on the graph. It is kind of very busy, but I would like you to focus on the 10 microgram dose, because this is the dose given to our 5 to 11 years old. So what can we see here? If we will look at the height of the graph, so after giving dose 1 to our 5 to 11, you can see that the most common reaction would be redness, followed by pain at the injection site. So this is true for both dose 1 and dose 2, followed by swelling at the injection site. And pain is the most common, I should say. Pain is the most common local reaction after dose 1 and dose 2, followed by, you can see, swelling at the injection site and then redness at the injection site. Look at the 10 microgram per dose. Now, moving on to the bottom of the screen, these are the systemic reactions after giving the Pfizer-BioNTech vaccine. And what we see here is the most common is fatigue, followed by headache, and very interesting, after the second dose, we can see that chills has been observed after giving the second dose of the Pfizer-BioNTech vaccine. But mostly, these adverse reactions are mild to moderate in severity. This is the result of the phase 1 clinical trial. Next. For the safety data, phase 2 and 3 clinical trial, you can see that it is almost similar or similar to the result of the phase 1. Local reaction After giving the Pfizer-BioNTech vaccine, the most common is pain at the injection site after the 10 microgram dose. So this is observed for both dose 1 and dose 2. As for the systemic reaction on this side of the screen, on the right side of the screen, then we can see fatigue, headache, followed by muscle pain, and this is similar to what we have seen in the phase 1 safety studies. Next. So overall, the safety profile of the Pfizer-BioNTech vaccine to children 5 to 11 years of age, typically side effects are mild to moderate, with a majority of events arising within the first 1 to 2 days after vaccination and resolving shortly thereafter. And as I have mentioned, the most common local reaction was pain in the injection site. And the most common systemic reaction included fatigue, headache, muscle pain, and chills, especially after the second dose. Vaccine recipients reported more local reactions and systemic events than the placebo recipients. And then the adverse event profile after vaccination of this age group mostly reflects reactogenicity with low incidences of related or severe events. In general, the systemic events were reported more often after the second dose of the Pfizer-BioNTech vaccine than after the first dose. And the use of antipyretic or among vaccine recipients was more frequent after the second dose than after the first dose. Review of AEs or adverse events, severe adverse events, and AEs of clinical interest suggest no short-term safety concerns after administering the 10 microgram Pfizer vaccine. As I have mentioned, this dose is for our 5 to 11 years old target. And no cases of myocarditis, pericarditis were observed during the vaccination period through approximately 3 months of follow-up after the second dose. Next. So this is what we got from the Department of Health. This is the report. Adverse event following immunization report as of February 11. And we can count. There are only 1, 2, 3, 4, 5, 6, 7, 8 or 9. 8 AEs reported among 5 to 11. And mostly mild. 1, hindi pa namin na-follow up, not recovered, ongoing, the vaccination site pain. And there was heaviness in the arm that was injected. And this female child complained of chills. But then overall, as I have mentioned, the severity is mild. So this is our own report, and we are also looking at adverse event in our vaccination, ongoing vaccination here in Dagupan City. So I think Ma'am Nina is up next.
Yes.
Over to you, Ma'am Nina.
Yes, thank you very much, Doc Wilda. Well, you have shown the safety profile of the Pfizer vaccine. Well, not only for children, the 5 to 11, but of course those above, 12 years and above. So I'll move on to the immunogenicity data, and we have very good data here. If you note here, these data are about neutralizing antibody titers from phase 1. They tested the 10 microgram dose or the 20 microgram dose. So note here, this is the percentage, the serum neutralizing antibody titer. And you note that 7 days after the second dose, using the 10 microgram Pfizer vaccine, they generated, ito yung titer, 4,163, 10 micrograms to, no? Doon sa 20, almost the same. Just a little bit higher, pero hindi naman different yung dalawa na yan. So, 20 micrograms, 4,583. So, the neutralizing antibody titers generated against 10 microgram or 20 microgram Pfizer vaccine 7 days after the second dose are almost the same. So, pareho lang, no? So, kaya, they chose the 10 microgram dose because, you know, the less dose you give, the better yung parang safety response niya. Yung reactogenicity becomes lower. So, that is for the phase 1. So, dosing lang muna yung tinignan nila dito. And then, check na. Next, please na. Kala ko ako nag-move. Next slide, please. Okay. Now, here we show yung difference in the immune response when given to the 5 to 11-year-old group and against yung 16 to 25. Remember, yung sa 5 to 11, 10 micrograms. Do sa 16 to 25 na kinokompara nila, they gave 30 micrograms, which is the adult dose. But you see that pareho halos yung results. So, parang yung nakita nyo doon sa phase 1, although between 10 and 20 yon, pareho yung response. So, up to 30, pareho, no? So, the serum neutralizing GMTs post-dose 2 of the 10 microgram dose of Pfizer vaccine was, ito, 1,198 geometric mean titer for the 5 to 11 years old, showing 118.2 geometric mean fold increase from baseline versus yung doon sa older, yung 16 to 25 years old, na halos pareho, 1,147 geometric mean titer and with 111.4 GM fold increase from baseline. So, kita nyo, parehong-pareho, no? So, yung increase from before vaccination to 1 month after vaccination, the increase is about 118.2. In the Pfizer, yung 16 to 25-year-old, this is 111, ang increase is 111.4. So, basically, of course, higher. Ito yung placebo lang, wala namang vaccine, pero parang baseline lang. Okay, and here we show dito sa left lower panel here, it is stratified according to the age. So, pare-pareho lang halos, no? Yung 5 to 6 years old, ang GMT nila is 1,164. For the 7 to 8 years, 1,236. And 9 to 11, 1,191. Hindi sila nagdi-differ masyado. So, that is why you have your 1,198 GMT for all the 5 to 11-year-old. So, maganda, no? Ang data nila. So, similar, even if you reduce the dose to 10 micrograms, you generate the same immune response, at least in terms of the neutralizing antibody response. Next slide, please. So, now this one shows the efficacy nitong Pfizer vaccine. Ito ay phase 2 to 3 clinical trial data for the 5 to 11-year-old children. So, very, very simply lang, we have to show this, that among participants, they tested with or without evidence of previous SARS-CoV-2 infection, there were 3 cases of COVID among those vaccinated, 7 days, at least 7 days after the second dose. And you compare this with those who were not given the vaccine, o ito yung placebo group, there were 16 cases of COVID among these not vaccinated or placebo recipients. So, that gives you a vaccine efficacy of 90.7%, which is also shown here. Now, also, there were no cases of severe COVID in these cases, or yung inflammatory syndrome in children were reported. So, wala. So, now I'll move on to the next one. So, 90.7 VE. Next one, please. I'll just include one study on the MIS-C, I think. Next slide, please. Okay. Ito. So we were saying about the vaccine being effective against severe form, especially of COVID, and walang na-report na MIS-C. What is MIS-C? This is a study by Zambrano et al. So what is MIS-C? Multi-system inflammatory syndrome in children, MISC, is actually a severe post-infectious hyperinflammatory condition which occurs 2 to 6 weeks after a typically mild or asymptomatic, even asymptomatic infection with SARS-CoV-2 in children. The virus, so with SARS-CoV-2, so ito yung natural infection. Mild or even asymptomatic can give you MIS-C. But what they have shown is that when you give 2 doses of Pfizer vaccine, it is highly effective in preventing MIS-C in persons aged 12 to 18 years above. So it is shown here in the CDC infographic, so that the COVID-19 vaccination protects against multi-system inflammatory syndrome in children among 12 to 18 year old children hospitalized during July to December 2021. And the vaccination reduced the likelihood of MIS-C by 91%. So if you look at further here in the middle, the adolescents hospitalized with MIS-C, 95% of them were unvaccinated. And those who were vaccinated but also mayroong konting-konti, no? Konti lang to, who also got MIS-C, required no life support. Ibig sabihin, hindi siya naging severe or critical. So, COVID-19 vaccination, what CDC is saying, is the best protection against MIS-C. Although this is rare, no, but still we want to highlight the importance of vaccination in actually protecting or preventing MIS-C in these children. So next slide please. Baka the next one will be back to Dr. Wilda, who will talk about the general and other adverse reactions following vaccination.
Thank you, Ma'am Nina. So it's my turn again, general and other adverse reactions. I talked about the safety data of the Pfizer-BioNTech vaccine a while ago. So in clinical trials, the adverse reactions in children 5 to 11 years following the administration of the primary series. I mentioned this, pain at the injection site was the most common. We also observed fatigue, headache, injection site redness, injection site swelling, muscle pain, chills, fever, joint pains, lymphadenopathy, yung namamaga yung kolane, nausea, malay, decreased appetite, and rash. Adverse reactions in individuals 12 years and older naman. The post-authorization experience reported severe allergic reaction, including anaphylaxis, other hypersensitivity reactions, examples, rash, pruritus, nangangati, urticaria, nagpapantal-pantal, angioedema. There was also report of diarrhea, vomiting, pain in extremity where the vaccine was injected, syncope, bigla na lang nawalan ng malay, and has been reported following administration of the Pfizer-BioNTech COVID-19 vaccine outside the clinical trial, so real-world experience. Now, very interesting, myocarditis and pericarditis have been reported following administration of the Pfizer-BioNTech COVID-19 vaccine, again, outside of clinical trial. Next slide. Okay. So, myocarditis and pericarditis, the post-marketing data demonstrate increased risk of myocarditis and pericarditis, particularly within 7 days following the second dose. So, myocarditis, ito yung nag-i-inflame or namamaga ang heart muscles. And the observed risk is higher among males under 40 years old than among females and older males. And the observed risk is highest in males 12 through 17 years old. So wala doon masyado sa mga pediatric age group or younger pediatric age group. It is highest in males 12 to 17. Although some cases required intensive care support, available data from short-term follow-up suggests that most individuals have had resolution of symptoms with conservative management. But US CDC has already published considerations related to myocarditis and pericarditis after vaccination. This is in their website, including for vaccination of individuals with a history of myocarditis or pericarditis. Next slide. So, sorry about that. So, these are a lot of numbers, but then these are the ratios comparing the rates of myocarditis diagnosis of vaccine compared with historical period of unvaccinated individuals. So, nakita natin kanina, nabanggit ko kanina, and it is shown here as well, na most common talaga siya sa male rather than in females. And for the age group, it's 16 to 19. No? So these are the numbers. Next. But, okay. This is a very good slide on myocarditis and pericarditis, and we want you to get the facts. So COVID-19 myocarditis, myocarditis and vaccines, as I have mentioned, ano yung myocarditis is inflammation of the heart muscle, and this can happen after viral infection like COVID-19, because COVID-19 is a viral infection. And it is very rare after receiving the mRNA COVID-19 vaccines. Most people with myocarditis following vaccination, they recover completely. Conservative treatment with rest and simple treatment, they can recover completely. However, if you get myocarditis from a viral infection like COVID-19, this can be very severe. So look at the numbers. If you are unvaccinated, 4 times to 8 times higher risk of myocarditis from COVID-19 infection in all ages. So that's 10 times higher risk of hospitalization from COVID-19 infection if you are unvaccinated. But if you receive the COVID-19 vaccine, the overall risk of myocarditis is extremely low. It's 1 in 200,000 population. Younger males, 12 to 29 years old, have a slightly higher risk, but still very low, 1 in 14,000. For females, mas mababa. 12 to 29 years old have a much lower risk compared to their male counterpart. It's less than 1 in 100,000 population. And it says this is the same chance of being struck by a lightning in one's lifetime. Yung 1 is to 14,000 population na myocarditis risk among vaccinated males. So the overall message here is don't miss your shot. Your heart is safer with COVID-19 vaccine. Next slide. So these are the countries that has approved Pfizer vaccine and also other vaccines, not necessarily the Pfizer vaccine for the 5 to 11 years old. So marami na tayo. You can see here at the bottom right side of your screen, Philippines, finally we have approved the EUA of the Pfizer-BioNTech vaccine for the 5 to 11 years old. May asterisk po yung Cuba, Argentina, and Bahrain, although they have actually they are vaccinating younger than 5 years old, but they are not using the Pfizer BioNTech vaccine. So nakakatuwa, Cuba is vaccinating as young as 2 years old, Argentina as young as 3 years old, and Bahrain as young as 3 years old as well. And they are using other vaccines other than the Pfizer vaccine that we are using here in the Philippines. So these are, we hope that in the future we can also inoculate younger population to really realize that herd immunity and that community protection that we all want to achieve and finally end this pandemic. I think this is my last slide, Ma'am Nina, before I turn
Yes,
over
yes.
to you again.
Thank you very much again, Doc Wilda. And we move on to the last few slides so we can have the next one. And this is about the World Health Organization SAGE recommendations on Pfizer vaccines for the 12 to 17 and 5 to 11 years old as updated last January 21 this year. So, what they're saying is that children 5 to 17 years of age with comorbidities that put them at higher risk of serious COVID-19 disease should be offered this COVID-19 vaccination. So for healthy children and adolescents, COVID-19 is usually a mild disease, and we all know that, no? But some children can actually experience significant morbidity like what we have earlier mentioned, yung MIS-C, even after mild or asymptomatic infection, although this is rare. So last January 21, the World Health Organization Strategic Advisory Group of Experts on Immunization issued this update on the roadmap for prioritizing the use of COVID-19 vaccines, in which children and adolescents, especially with comorbidities, are identified as a medium priority use population group for the administration of primary series and booster doses. And in accordance with the WHO, they have this prioritization roadmap. WHO recommends that countries consider using Pfizer vaccine in children 5 to 17 years only. So, and we have to actually go by this, no? When high vaccine coverage, yung primary series and boosters, has been achieved in the higher priority use groups. So actually dito sa atin, sinusunod naman natin ang priority na yan. So next slide please. Further to that, the administration, the recommended schedule is, as we already said, 30 micrograms for 12 years and above and 10 micrograms only for children 5 to 11 years old. So actually there is this additional recommendation of WHO that the second dose should be provided 4 to 8 weeks after the first dose. So 1 to 2 months. So normally it's about 3 weeks or to 1 month. They are actually saying or recommending up to 8 weeks or 2 months. Preferentially pa nga yung 8 weeks, as a longer interval between doses is associated with higher vaccine effectiveness and potentially lower risk of myocarditis or pericarditis. So this is WHO recommendation, but I think we have not actually followed this yet. Now, the booster dose or the third dose is recommended 4 to 6 months after the second dose is given, increasing evidence of waning of vaccine effectiveness over time, further compounded by lower vaccine effectiveness against Omicron and Delta that can be restored with a third dose. Especially they referred to, yung update was really more for the immunocompromised, so updated regarding the need for a third, even a fourth dose in certain immunocompromised populations, as we already mentioned, as defined by WHO, CDC, and FDA. And the need for and timing of booster doses, however, for these children, to younger, 5 to 11 years, has not yet been determined. So next slide, please. Yung Now, there is this other article that we saw. I really dug this up, no? Yung CDC, kasi I keep getting questions about yung waning immunity. Kailangan ba ng 4th dose, ng 5th dose? Yung iba nga naka-6 na eh. Sobra na yun, no? So, this is CDC studying waning immunity. Pero they're looking at messenger RNA vaccines lang. Kasi yun lang ang meron sa US, di ba? Of course, yung J&J. Pero largely, Pfizer and Moderna. This is as of February 12, 2022. So, what they showed here is that during Delta predominant periods, Delta, no? So, earlier pa to, no? Ngayon yung Omicron. Vaccine effectiveness against symptomatic COVID dropped, COVID-19 yan, hindi 17. COVID-19 dropped from 97%. So, within 2 months after binigay yung boost, 97% yung kanyang vaccine effectiveness. Nung 4 months, 2 months later pa lang, after nung 2 months na boost, naging 89%. But take note ha, mataas pa to, from 97 to 89%. And during the Omicron predominant period, which is later na, no, the VE against symptomatic COVID-19 dropped from 87 to 66% 4 months after a third dose. So, dun sa Delta, medyo mataas pa, pero kita nyo yung immune escape ng Omicron talagang grabe, to 66%. Pero, what this is showing is, while it has dropped, hindi naman ganun kababa. And even if you look at the Omicron drop, yung 66%, 4 months after a third dose, that is still high. Per yung WHO target product profile na yung threshold nila na 50%. So, that's still okay. So, and please take note also that we are trying to say na hindi naman, ang basis nito ay yung nagkaroon ba ng COVID o hindi, and then of course some neutralizing antibodies, pero meron pa rin tayong mga T cells na will take care of us or will be sustained to protect us against the children against severe COVID. Then, ito yung against symptomatic COVID. Yung protection against hospitalization during the Delta variant surge declined from 96% within 2 months after the boost to 76% 4 months after 4 months or longer. And for Omicron, the drop was from 91% to 78% at 4 months. So makikita nyo, the protection is really still high against hospitalization, which is really do sa mga severe and critical cases of COVID. So that protection conferred by messenger RNA vaccines, and we're not talking about other vaccines here, waned in the months following a third vaccine dose, may support consideration of booster doses to sustain protection against especially moderate to severe COVID illness and especially among the immunocompromised but not yet for the general population. So yun yung main message. Pwede sa immunocompromised but not yet for the general population. Kasi still, kahit bumaba, hindi ganun kababa, hindi naman 30%, 20%. And we still have the T cells to help us. Next slide please. I think this is the last then I just go through the summary of the data we have presented. The reactogenicity profile presented by Dr. Wilda in children 5 to less than 12 years of age was typically mild to moderate, resolving within 1 to 2 days. The review of AEs, SAEs, AEs of clinical interest suggests no short-term safety concerns after administration of the 10 microgram Pfizer vaccine. And there were no cases of myocarditis, pericarditis observed during the vaccination period through approximately 3 months of follow-up post-dose 2. And for immunogenicity, you have seen that the serum neutralizing GMTs post-dose 2 of the 10 microgram Pfizer vaccine in this age group is comparable to that in the 16 to 25-year-olds. Pareho lang halos, GMR of 1.04. And efficacy was placed at 90.7%. And no cases of severe COVID-19 and no cases of MIS-C were reported as of the data cut off. So with that, I think I'll just have the last slide as a thank you. Thank you sa inyong lahat for your kind attention, and we can move on to the Q&A. Thank you.
Hello at maraming salamat po Doc Nina and Doc Wilda for that very comprehensive very comprehensive presentation on Pfizer. Now we move on po to our question and answer portion of this program. Uh, so I think we can accommodate a few questions before we reach our time limit. So let's start. Our first question po ay mula kay Sheila Crisostomo of the Philippine Star. Ilang months po bago mag-wane ng immunity ng Pfizer vaccines for 5 to 11 years old since 10 micrograms lang po ang isang shot? Maybe Doc Nina or Doc Willa can answer this question.
Okay, ako na muna. So far, yung data are not for the children, the 5 to 11, more of the 12 above. Kasi yung 5 to 11 were just given their vaccines, no? Major recent. But they will be monitored also. But if you look at yung kinetics, yung kanilang antibody response when compared to 12 years and above, I will not say na maiiba pa yon. It should be like that as well. But this is we're talking about only of messenger RNA vaccines here. Yung waning. And hopefully with the children, the waning will not be as low as that. Pero mataas pa rin naman kahit nag-wane, diba? 89, 76, although with Omicron it's a little lower. So we will still have to monitor for this particular age group. Now, yung 10 micrograms, talagang that is the dose for this age group. So, ganun din yung magiging kinetics ng response nila to the vaccine.
Maraming salamat po Doc Nina. Doc Wilda, would you like to add to that po or anything?
Yes, as Ma'am Nina mentioned, we're still learning a lot from this Pfizer biotech vaccine na binibigay sa 5 to 11. Pero yes, just like Ma'am Nina mentioned, I don't think there will be much difference dun sa resulta ng older population. Even though it's 10 micrograms, remember, the data we presented, the reason why they chose the 10 microgram dose for this particular cohort, the 5 to 11, is because yung sa safety profile niya, mas konti yung adverse reaction na nakikita mo with this dose, 10 microgram, as compared to the 20 and comparing it again dun sa 30 among this 5 to 11. But if you look at the efficacy data, pareho lang kahit anong dose ang ibigay. Kaya pinili yung mas konti or mas mababa na microgram is because of the safety data. Over to you, Kim. Thank you.
Alright, maraming salamat po Doc Nina and Doc Wilda. Just to to announce lang din po, I'll be moving forward without my camera because we are currently experiencing some internet issues. So please forgive me in advance if I may be choppy po. So moving on to our next question. We have a question, several questions on MIS-C or myocarditis. So maybe just to reiterate, although we've mentioned this in the presentation earlier by Doc Nina and Doc Wilda, maybe our experts could further explain the science behind the reduced chance of severity of MIS-C or myocarditis among vaccinated children. Maybe we could reiterate po kung how rare this is and how effective are vaccines sa pagdating ng reducing the chance of these morbidities or effects. Maybe Doc Nina could start, followed by Doc
Okay. Yes. Okay. Well, actually, by MIS-C, we mean multi-system inflammatory response, no? And actually, still a lot is not known about how this comes about. Kasi see, even with mild or asymptomatic children, you can get MIS-C. So it's probably also related to how their immune system reacts. No, so parang siyang yung similar siya yung Kawasaki disease that we've been experiencing before with some children way back, matagal na, following viral infection, itong Kawasaki, no? So multi-system, halos lahat, heart, may brain, may respiratory and everything. But clearly what is maybe, sorry, maybe lang to, no? Hindi naman din kami talaga na nakakasunod doon sa missing pathogenesis. But what is probably preventing the vaccine preventing it is because the vaccine will not allow the virus to actually replicate so much, even if it does konti, no? Kung mapiprevent niya yung virus from replicating or infecting dahil nga may protection, then you will not elicit that inflammatory response. But we're not very sure about how that inflammatory response actually works in these children. Hindi pa yan masyadong clear. But stopping the virus from getting into children by vaccination will of course do the trick there. So, kung wala yung virus, walang mag-i-incite ng inflammatory response. Of course, that still has to be clarified, and we still have to follow up with some yung pathogenesis, immunopathogenesis ng MIS-C, especially in children. But it is rare, as I have said. Doc Wilda?
Okay, maraming salamat po. Ay, sorry po, Doc Nina. Ayan, maraming salamat po, Doc Nina. Maybe Doc Wilda could further add po sa ating comments to Doc Nina on Miss C.
Yeah. Well, actually, Doc Nina mentioned about Miss C, and yun na yun. Ang dami nang nabanggit na information ni Ma'am Nina. And I think another question is about myocarditis. You mentioned myocarditis. Well, myocarditis kasi, the potential causes include a lot, no? We have viruses, we have bacteria, we have even parasites and fungi. So, napakadaming cause ng myocarditis. And as I have mentioned, nai-inflame yung heart muscles, kaya nagkakaroon ng tsansa na yung because of this inflammation, dahil ito sa pamamaga ng heart muscles, then the heart's ability to pump is reduced. So, yun yung myocarditis. Very simple explanation. And as I have mentioned, apart from viruses, marami pa ring causative agents ang myocarditis. So, why is vaccination helpful? Nakita natin doon sa napakagandang at a glance nandun na yung explanation kung bakit makakatulong ang pagbabakuna against COVID-19. Because COVID-19 is one of the possible causes of myocarditis in the general population. And if you do not get COVID-19 infection dahil nabakunahan ka na, then this will reduce your chance of developing myocarditis. In the general population, among the vaccinated population, nakita natin real-world data, may mga nakikitang myocarditis after vaccination, after receiving the dose 2 of the Pfizer-BioNTech vaccine. But we still have to analyze this data, look at the data. Ito ba talaga is secondary to the vaccine, or talagang merong concomitant infection post-vaccination that caused the myocarditis? These are the data, these are the things that we still want to investigate. No, we're not saying na it's not the cause, the vaccine is not the cause, or the vaccine is not the cause, but we still have to study this data, look at this data, and analyze this properly. But again, you have seen the slide. The vaccine can help you reduce the cases of myocarditis because you are eliminating COVID as one of the causes of myocarditis. Over to you.
Maraming salamat po muli, Doc Nina and Doc Wilda, sa pagsagot ng ating tanong. Now we move on po to questions relating to the interval ng ating mga doses when it comes to pediatric vaccination. So, I'm summarizing some questions here, but the general question is, gaano po katagal or ilang months dapat hintayin para sa bakuna na first dose and second dose ng bata? And in relation to this, how does this fit in with the WHO recommendation of 4 to 8 weeks sa interval? Maybe Doc Nina could start, followed by Doc Wilda po. Doc
Yes,
Nina?
yes. Thank you for that question. Actually, nakikita ko na marami about that. Dahil din doon sa sinabi ko yung WHO recommendation. But actually, the EUA that we amended for Pfizer for children, either 12 to 17 or 5 to 11, ang kanilang recommendation is for at least 3 weeks apart. So yun yung ngayon. But of course, itong recent, medyo recent tong data ng WHO, which they may have yung kanilang data from Pfizer, bakit nila nasabi na 4 to 8 weeks. Yung longer interval, that is known. We have known that. A longer interval will give better immune responses. But in the Philippines, as you know, actually, inano natin yung 6 months to 3 months, yung mga gano'n, no? Because we were balancing yung effect of the Omicron. Now, for this particular issue, so maybe we can consider it, but we have to give to review the data that they have, na meron pala sila talagang study na pag binigay after 8 weeks or 2 months ay better ang immune response. We have not seen that. So kung meron, sana na i-present na namin sa inyo, no? But wala so far sa ngayon. But maybe the SAGE, yung WHO group of experts, have those data, which is why they say that. But they were also looking at yung reducing the chance of yung ang MIS-C by giving a longer interval for the second dose. So, but we still have to see those data. But why not? We may have to reconsider. But right now, it is 3 weeks at least, or 4 weeks. Actually, better. Para sa akin, talaga better yung at least 4 weeks and then a little longer, but not too long. Because we also want the booster to come in quickly. So yun. We're still waiting. We may have to get those data to make such recommendation. But right now, wala pa yung data sa atin.
Alright, muli po maraming salamat, Doc Nina. Doc Wilda, is there anything po you'd like to add to that? Well, on what Doc Nina said?
Kompleto na yung sagot ni Ma'am Nina. Wala na akong may dadagdag.
Sige po, maraming salamat, Doc Wilda. I think for the moment, humihingi po ako ng paumanhin sa ating media partners. Pero I think that's all the time we have for today. Sa pag-cater sa inyong questions. We'll have another Kapihan po next week. And hopefully, we could cater more to your questions po by that time. But before we end, maybe I'd like to recognize po ang ating experts muli, si Doc Wilda and Doc Nina, to provide some closing messages and reminders po sa ating publiko on encouraging our population to get vaccinated, the importance of this, and so on and so forth po. Muli po, Doc Nina.
Doc Wilda muna.
Sige po. Sige po, Doc Wilda.
Okay, ako muna. You know, I was former National Immunization Program Manager of the DOH. And in the very first orientation on COVID-19 vaccination, I mentioned na before the advent of the vaccine, what we are doing is we do physical distancing. We are wearing masks, face shield even. We are very conscious to keep our hands clean. And this strict observance of the safety protocol, minimum health standard, public health standard, is what helped us, helped most of us in combating COVID-19 and preventing us from dying against COVID-19. Now, with the advent of the vaccine, I think this minimum public health protocol is still very important. Adherence to this is still very important. But since we have now COVID-19 vaccines in our midst, the wall that protects us against COVID-19 has been strengthened, has been reinforced. So please, go out and get vaccinated. Have your loved ones get vaccinated. Get your children vaccinated against COVID-19, but not just against COVID-19. We have routine vaccines for children under 1 year old, and they're given for free. Vaccines against measles, against polio, against pertussis, against diphtheria, against tetanus, just to name a few. So please, get vaccinated, have your children get this COVID-19 vaccine and other routine vaccines because it's a proven fact. Vaccination saves lives. Maraming salamat po at magandang umaga pong muli.
Maraming salamat po, Doc Wilda. And Doc Nina, your closing messages po.
Yes, thank you, Doc Wilda. No? Well, para sa akin, si Doc Wilda, public health talaga yan. Ako, more on the vaccine side, on the immunology side. So, but I'm really happy that over the last 2 years, we have made great strides in our vaccine development and efforts to actually deploy. So, hindi marami yung na-deploy sa ibang mga limited countries, pero sa Philippines, we have seen how much we have deployed over, nag-start tayo ng 1 year ago, March 1. So, malapit na yung March 1. And we have gotten this far. So, from the elderly, the highly, yung mga medyo higher risk for COVID-19, we started there and then we moved down to the lower age group, the younger age group, and now we want to, if I may refer back to the wall, the immunity wall that Doc Wilda actually said, yun yung immunity wall na we want to build. Sana yung wall na buo ang wall. So, ibig sabihin, lahat ay mabavaccinate, provided, of course, kung yung may younger pa, magkakaroon ng EUA for the younger, because we want to protect everybody. This SARS-CoV-2 virus is not a simple virus. We have seen how complicated and complex it is to study it, for even to know how immune system works against it, and of course yung vaccine. But we have come a long way, and hirap na hirap po tayo sa pag-review, sa pag-evaluate, sa pag-approve, and even sa deployment lalo, and we had to deal with hesitancy. But I am now happy na bumaba yung hesitancy, and we have to parang ituloy-tuloy natin, i-sustain lang po natin itong ating efforts. So nakita natin how the vaccine worked for us. Of course, do not forget yung minimum public health precautions to stop the virus transmission as well. So on that note, thank you very much for all your time here.
Doc Nina, maraming salamat po sa inyong messages. I think I could have said it any better, na vaccines po talaga are effective, safe, and of course free. And this po ang ating, along this vaccination along with minimum public health standards, ang makakatulong po talaga sa atin sa pagtugon ng virus na ito. Muli po, on behalf of the Department of Health, Doc Nina Gloriani, Doc Wilda Silva, maraming salamat po sa pagsali sa ating programa sa Kapihan this Wednesday. Now, sa ating pong media partners, muli po maraming salamat sa inyo, and we'll see you po next time in our next Kapihan. Maraming salamat po at magandang umaga. Keep safe.
Stay safe, everyone.
Stay safe, everyone. Thank you.